Hello, everyone. So we're on topic 4 of our research project, and this week's topic is how people's concept of pain differs and the effect of both neurological makeup and psychological influences, and like what effect they have on how one's brain perceives mental and physical pain. So we wanted to start it off by kind of just looking at these 2 different brain scans and explaining a little bit about them. So the first brain scan we have is this one where it goes through different graphs of like patients with depression, chronic pain, and then they have a control group. So you can see the differences in scans just right here. So this was a study by Professor Atsuo Yoshino, who specializes in anesthesiology, and he basically examined brain functions in like 3 different categories, like the depression, chronic pain, and then a healthy control. And he used a sample of 125 patients. And basically within his studies, he concluded that both depression and chronic pain lead to decreased productivity, social disability, and also increased healthcare cost. So the study shows that chronic pain right here showed higher pain sensitivity than healthy controls. You can see like even in the different area, more like red is like expanded into this section. And you can also see that it's expanded here as well. And so there's more reactivity in your brain to chronic pain than in these healthy controls and in more parts of your brain. And then also the study shows that patients used in like the depression category right here were more likely not to perceive pain stimuli compared to the controlled group. And you can see kind of like the gaps right here in comparison, as well as just like more yellowish rather than red areas that's like in this control group. The second brain scan we wanted to bring up, you can see the second brain scan, right?
Mm-hmm.
Okay. I'm going to move you a little farther up. Okay. The second brain scan we wanted to bring up was this group called WAGER, and they proceeded with a recent study of whether scanned brain activity when in pain correctly like represented self-reported pain experiences. So you guys can ignore these numbers, but basically you see the stimuli, which is the red and yellow sections of the brain, and how it can be moved around and how it's in like different areas. But basically the fMRI reported that pain levels was 94% sensitive, as well as the patient could distinguish pain apart from an external non-painful warmth that also was inflicted upon them. Patients also had a high pain anticipation and recollection. So their brain was able to prepare for the painful stimuli that they volunteered to have put on them, but also had like memory related like formats on like which different types of pain and just the pain levels correlated with what they possibly were given in the past. But also the study mentioned that pain is a personal experience. So different people have different sensitivity to pain. So the scan could not be 100% accurate. So take these results with a grain of salt, because this not necessarily is for everyone and could just be these specific examples that they studied upon.
Yeah, totally. And like I thought those were really awesome scans because it's cool to see like the different areas of the brain that are affected. So, what I'm going to be talking about is kind of like how physical pain then affects the mentality of people. So, for example, like I have a few friends who will have like stomach pain and then they'll like get a little quiet and like not want to interact with people as much. And like personally, I go through PMDD, which is post or premenstrual dysphoria disorder, where I get like kind of like achy and quiet and like kind of feel icky, and like that makes me kind of shut down, and like it like impacts my mental health a lot, and it makes me a little bit like more irritable and like tired and just kind of want to be away from people. And physical pain and emotional pain, like it definitely go hand in hand, and chronic pain can actually trigger anxiety and depression and a ton of other mental health issues, and it increases your risk of substance abuse and suicide in some cases. So it's like really important to be like mindful of your mental health and your physical health, because if like, for example, if your physical health isn't doing great, your mental health is going to plummet along with it, and vice versa. So I thought that was really interesting to see how those two connected. And then there's a scale for the physical pain levels. And I actually experienced it once because I went to the emergency room after a really bad horseback riding accident. I was fine. But they asked me how bad my head felt because I thought I had a concussion. And it was like a scale from 0 to 10. So 0 is pain free, and 10 is like excruciating, extreme pain. And from 0 is obviously pain free, 1 to 3 is mild pain, 4 to 6 is moderate pain, and then 7 to 10 is extreme pain. And then as I said, you know, like pain definitely affects your mood, and like living with pain can definitely be a mood damper, because it like obviously you don't feel well, and it's like you're not at your most potential to have fun and like be the best self you could be. And mood disorders can promote like people's dependence on like prescription medications that help treat pain. So like drug abuse is a common thing that comes up with like chronic illness or chronic pain, because you not only have something that's like always lingering on you, but then you get the medicine, and like you have something to like kind of like take away not only the pain but also the emotional pain. So it's really important to like be aware of yourself and get help if you need it, and like get checked out by a doctor or talk to a therapist or someone who you trust that can help you.
Yeah, so kind of in the same like thought process connected to it, we kind of wanted to ask the question, like, how does mental pain affect long-term performance in academic settings? Because this is specifically important to us as students who particularly have some mental illnesses, especially me. But basically, how people react to pain is shaped by their past experiences. So everyone goes through things, maybe trauma or just like anxiety on certain situations. And surrounding certain situations, but basically long-lasting mental disorders such as depression can cause decreased ability to perform in school, in work, or in social interactions. And like research supports the idea that depression is connected to a lower GPA average, as well as like reasoning behind dropping out of school. So you can kind of see the connection between like these mental illnesses, particularly depression, that really can affect and shape people's lives, and such as things like dropping out of school is seen as like something you like shouldn't do and is very bad and is kind of like not socially acceptable. But thinking about it, like if depression was the reasoning behind why they dropped out of school, like condemning them for it, it's not really their fault if they couldn't seek out the help that they need. So yeah, and also just like lower GPA averages, that's kind of concerning on a standpoint of like, I know I have test anxiety, which really affects like how my schoolwork and just testing in general for me, especially standardized tests and like APs and such, super are negatively impacted by my own anxiety. But also like when I get into, depressional episodes, it prevents me from doing like schoolwork. So if I have a test coming up at the end of the week and I can't be doing my homework or studying just because I'm in this mood and there's no motivation, there's no energy and such like that, it's just detrimental to your schoolwork and your life just in general. But yeah, the American College Health Association surveyed students, and 30% said that stress negatively affected their performance, which is kind of similar in our own experiences, both Jade and I. But also 22 reported that anxiety made academic life more difficult. And 20 mentioned the negative effect of sleep difficulties, which, I definitely, as a Hopkins student, can like say that sleep really affects how I am the next day. And especially if I'm staying up late working on a project that I have for the next day, I won't be really motivated or just have the energy at all to do homework when I get home that day, or pay attention in classes sometimes because I'm so tired. There's just like, I don't have the ability to really give the teachers attentions on what they're teaching. 14% also said that depression made it difficult to attend classes and keep up with work, which I know also a lot of my friends who suffer from severe depression, they really struggle to turn in any work or start any work or continue any work, depending on who they are and like what they're particularly struggle with. But like some of my friends just can't really show up to classes sometimes because they need to be in a certain mindset. Otherwise, the class is just going to set off their certain mental illness and they don't really have the energy to take that.
Mm-hmm.
We also wanted to see how like the long-term effects of mental illnesses have with social connections. So those with depressive symptoms have more frequent negative social interactions, and oftentimes also have stronger reactions to them. So this can mean either being, not in the right mood, so reacting more like aggressive, or reacting just not at all and not giving any reaction, which can also make awkward situations. Definitely, you can see the impact within those social interactions depending on their own mood. And this is like more intense than just like moodiness, which sometimes people get if they're like grouchy or tired or, woke up on the wrong side of the bed. You definitely do that. But like, this is like more intense than that and more like not just a one-day thing, but could be like longer than monthly of this same like continuous inability to have these social interactions because of how hard it is to react yourself.
Absolutely. I completely agree.
Also, due to a humanly need to interact with others and form bonds, the lack of positive social interactions often worsens mental conditions. So not only do you not want to spend the energy having these social interactions because they're mostly negative, but because you're not having these social interactions, it then puts you in this like never-ending hole because it's causing the mental illness to get worse. So those worsening conditions can then create even more pushback of social interactions, which can like dig you deeper into that hole. And so it's all just like this like very negative, unending cycle until like actual help is sought out. Depression also creates a difficulty for people to feel a sense of belonging in relationships, which can also be detrimental. It definitely can affect both trust issues, just in general, not being able to interact in a meaningful way. So there's like no point, and you don't really feel like you want to burden other people and such like that. So you just completely cut it out at all, which can really like make people themselves feel like lose that self-confidence and feel like if they do reach out in these social interactions that they're going to end up hurting someone or hurting themselves. People with high anxiety also are more likely to avoid social interactions, which is like a necessity to mental health and connections. So by, again, not interacting, you're digging yourself into that loophole. Anxiety also causes a decreased inability to make decisions when in social interactions. So you can miss like social cues or just not be able to like decide on simple things, needing help just throughout the conversation, as well as like anxiety negatively impacts one's capability to trust other people. So you might be like become paranoid or just not be able to really think that either someone cares about you or that they actually want to talk to you. And that kind of anxiety can be really like detrimental to your mental health, not just like further, not even just like further increase your anxiety, which sometimes it does. But on the other spectrum, if you're suppressing these like emotional, like just emotions in general, and when you're in emotional distress, oftentimes like in order to not feel burdensome to people, they can bottle up their emotions. I know I personally also do this, and then like I'll end up snapping one day because I'm like, well, I'm so tired of bottling it up, but it's not really like the other person's fault, and it just makes situations like drastically worse because, you know, it could be like a small issue, but because you've been bottling it up for a while, it just, you know, all comes out at once.
That definitely happens to me. You are very well aware of numerous situations in which there have been triggers, and I've been kind of like slowly like creeping towards my boiling point. And like there's just like little tiny things, and then like one thing that'll just set me off, and all of a sudden I'm like a mess, and then you have to deal with it. But like it's always nice to like get it out. So I feel like in those situations, it's communication is so key. But like as we've been talking about, that can be really hard for people who feel like they like can't communicate. And I think that's like an important thing to keep in mind, because it's like communication can be really, really difficult, you know, like, and I feel like it's just kind of like being open and welcoming to anyone who like feels like they need to communicate but doesn't know how, and like helping them like figure that out is really important, especially in like the whole mental health awareness and like and making sure people feel safe and happy.
Yeah, so like on the topic of you, we also kind of want to talk about mood swings because of emotional suppression. But like it can cause increased mood swings, higher anxiety, increased irritability, which you also have when you have been like really sitting on something but not want to like confront them about it yet. It can also cause physical pressure on your body. So this like anxiety or, you know, just frustration with a certain person, but you don't want to actually like talk to them about it. It can like cause you to be physically sick, whether that's just anxiety like nausea or migraines or just like pains in generals and aches around your body. But surprisingly to me, it can also raise your likelihood of getting diabetes and heart disease, whether that's just like heightened blood pressure from like suppression or also, you know, some people may cope by eating. I definitely eat my emotions, so I relate to that one personally. But just physically, it kind of deteriorates your body and your mental health. So overall, not a very good thing to use as a coping mechanism. But suppressing your emotions can also increase memory and aggression issues. So if you're like specifically focused on this one thing, it may be hard to like remember other events that are happening because you're so focused, or you're just like already drained by suppressing such emotions you don't want to let out yet. Then it can really like fog your memory in that sense, and cause you to be more aggressive in your day-to-day interactions. University of Texas did a study that proves suppressing emotions can cause them to become stronger. So it may start out with like a simple argument that isn't really that big of a deal, but because you suppressed your emotions for so long, it became more and more aggravating to you and just cause like, it could cause a big blow up. It could just like, you're so frustrated with it because you've been thinking about it and you find new things to become frustrated with in the situation. But that's why coping is key, finding good coping mechanisms for these mental, like these strong emotions rather than suppressing them. But yeah, now we kind of want to talk about, again, touching upon the physical side of it related to mental health, but mental health issues influence like physical pain levels and speed of recovery. So like my dad, he got hip surgery not that long ago, because he like broke his pelvic bone. And at first, he was like not really getting better because he was so stuck on the fact that he couldn't do the things he did before. You have to like relearn things like how to walk, which, you know, mentally, like being an adult and like thinking I can't walk right now, and it's something that's so like important that we take for granted every day. It's just like draining on your mentality because you feel like you're useless. You feel like you like can't do anything. Which is why like staying in this like mental homeostasis of like positivity that will actually help your recovery speed up and lead to better results. Which is why mental health should also be taken account of by physical therapists in their patients' therapy. I was reading a lot about physical therapy and how the best like physical therapists actually take into account the person's mental state and reassure them and validate them and like tell them like it's normal not to be able to walk right now. You'll get there. You need to take baby steps because you're relearning this because your body was just altered. Like you physically were altered. So of course you're not going to be able to do everything that you like did before. Then again, if we're talking about like professional athletes who built a life around being able to physically move and ended up injuring themselves, well, that not only could change their body, but completely altered their life probably for the rest of their life, unless it can like get better quickly and well enough for them to be able to compete again. So it's really like personalized subject in the sense of like, is this really detrimental for a short period of time? Is this detrimental for an elongated period of time that now you have to change your career path and find something else that you get to do? But it just all depends on the situation. And that's why mental health is key, because it can really shape, like, you can shape your mental health around what you need to overcome based on your physical disability. But yeah, that was kind of our little spiel for today. We hope you guys enjoyed the video, got a little, basic sense of like, this is like my line of work. So like neuroscience, brain scans were like super interesting.
That's why I let you do a lot of the talking this time.
But just a little basic intro to like touches upon neuroscience in general. But yeah, thanks for watching.
Thank you.